Welcome to WatchPOGO.com. Like our video and don't forget to subscribe. Whether we're visiting our doctor's office for a regular checkup or just being rushed to the hospital, we're usually expecting to receive some standard of a medical service. Unfortunately, this isn't always the case, and things can sometimes take a turn for the worst. We have compiled a list of top 5 disturbing cases of medical malpractices. Coming at number 5. Doctors perform open heart surgery on the wrong patient. Doctors completed the procedure. They mistakenly transferred Miss Morris to a different floor than the one that she was originally on. Instead of being discharged in the morning as originally planned, she was taken in for a open heart surgery. The mistake was not realized until an hour in, when a doctor called and asked what his patient is doing open. Coming at number 4. Doctors ignore patient symptoms resulting in death. In June 19, 2008, a 49-year-old woman died unnoticed on the hospital floor at Kings County Hospital. Esmond Green had been in the waiting room for nearly 24 hours before collapsing on the floor and slowly dying. However, since then, the City Health and Hospital Corporation has taken full responsibility of the situation, and even eventually, New York City agreed to pay the family of Esmond Green $2 million. Hopefully this could bring change in the healthcare system. At number 3, surgeons forget tools inside their patients. On June 2000, a 49-year-old man by the name of Donald Church went in for a surgery to have his tumor removed from his abdomen. Although Mr. Church had the tumor removed, he got a surprising souvenir during his surgery. The surgeons performing their procedure left a 13-foot malleable retractor inside of Mr. Church. The instrument is intended to be held partially outside the opening during a surgery. However, it somehow slipped inside of Mr. Church during the surgery. The instrument was eventually removed upon being discovered, but Mr. Church was not happy, saying the pain never went away after the operation, and as soon as I got home after a week from the hospital, the instrument began causing problems. He didn't suffer from any long-term health issues after its removal, and a settlement was reached between the Washington Medical Center and Mr. Church for the amount of $97,000. At number 2, man regains consciousness during his surgery. This is everyone's worst nightmare going into surgery, waking up while it's being performed. Such a case did occur in 2006 when a 73-year-old minister from West Virginia, Sherman Sizemore, went in for surgery but suffered a rare condition of anesthesia awareness. The surgery was initially intended to explore the causes of abdominal pains that Mr. Sizemore had been experiencing for some time. The attending surgeons did not realize that Mr. Sizemore was experiencing severe discomfort and continuous pain during this procedure, mainly because when a patient is suffering from anesthesia awareness, he or she is able to feel every ounce of pain during the surgery, but is unable to let anyone know. At one point, Mr. Sizemore, even though he was being buried alive, it was later discovered that the doctor present during the surgery did not give Mr. Sizemore the adequate amount of anesthesia to keep him conscious. Sadly, after 2 weeks after the surgery, Mr. Sizemore committed suicide. Number 1. Amputated wrong leg. Some patients are fortunate enough to only end up with a few scratches and wild stories from medical malpractices they might have experienced. However, others are not as fortunate and may have to deal with some serious long-term consequences from surgeon mistakes. In 1995, a 52-year-old man like Mr. Willie King was admitted to the University of Community Hospital in Tampa, Florida, to have his leg amputated. Unfortunately, somehow the surgeons present ended up amputating the wrong leg. By the time the surgeons had realized what they had done, it was too late, so they had to complete the procedure. As a result, the surgeon had his medical license revoked and was fined $10,000 for the mistake. The hospital ended up paying Mr. King $900,000, and the surgeon also personally paid him $250,000.